Your world, your challenges, your faith. When faith within engages the world without, there's power. It's living life from the inside out.
Right now, we're probably more distant from the people we love than at any other time in our lives. We do this to keep each other safe from the pandemic. It's hard on everyone, but for the more than 5 million Americans living with Alzheimer's disease and the untold numbers with other dementias, it's possibly more than just difficult. The isolation intended to keep people physically healthy may be worsening their overall health. We're going to talk about this today on the Family Life Inside Out podcast with Dr. Anafidelia Tavares. Dr. Tavares holds degrees in medicine and public health and is the Senior Director of Programs for the New York City chapter of the Alzheimer's Association. Welcome, Dr. Tavares.
Thank you so much for having me and the opportunity to talk about this really important topic for families across the United States.
Mm-hmm. Dr. Tavares, what are researchers learning about the impact of social distancing and social isolation on people living with Alzheimer's disease?
Well, as you can expect, it's having a huge impact in terms of, social distancing ending up in social isolation. But one of the things that researchers are learning is it's not one and the same. We can have social distancing or physical distancing, but just because we're physically distancing doesn't mean that we're socially distancing. So there are practical ways that families can take to stay in touch, to lessen the blows of physical distancing so that those health impacts aren't as great. We definitely need more research, and so the Alzheimer's Association is definitely funding that research, participating in large multi-country studies on the impact of COVID on dementia and the brain. So while we wait for the researchers to come with this extensive body of research that we can then put in place, there's some practical tips that families can take right now while we're waiting on researchers to build that body of evidence.
That is encouraging. Dr. Tavares, allow me to reset. If you're just joining us, you're listening to the Inside Out podcast on family life. I'm talking today with Dr. Tavares of the Alzheimer's Association. So Dr. Tavares, you've given us an encouraging beginning here. If we love someone with Alzheimer's disease or with any memory issues, and that person is living in a group facility that we cannot visit or cannot visit often, are you saying that there are ways that we can soften the impact of our loved one's isolation?
Absolutely. So again, we can stay physically distant without being socially isolating. And so ways that we can do that is think about, well, if they're in a facility, how can you stay in touch? Can you go outside their window and do a virtual parade where family members come with signs and then over the telephone you're having a conversation, so you're kind of feeling together even though you're apart? You can drop off care packages with some of their favorite foods and activities they like to do, obviously, so that it's well packaged and disinfected so that they still know that you care. We can also use technology. So we are in a time when we have small computers in our pockets, and we can use that to stay socially connected. We can do family Zoom calls where we get members of the family together, get an MC who puts some order to what we're doing as a family, but we can do that to feel socially connected and not alone. And so those are really important strategies. And even with older adults who many times are not good with technology, we can still do that with telephones. So we can have check-in calls and just, putter around and, watch the same film together and check in so that even though we're apart, we're still socially connected. So those are some tips that family members can use. But if they're struggling with coming up with ideas, I encourage them to call the Alzheimer's Association 24/7 helpline, where they can speak to one of our social workers and counselors and get some concrete tips for their situation in terms of how they can stay socially connected.
Those are great ideas. And I like the suggestion of an MC for when you're doing the Zoom call, because I know that it can be very confusing when people layer conversation. And if you have somebody who's actually bringing some order to that conversation, I imagine it'll be much easier to follow and then less frustrating for the person who you're trying to benefit.
Absolutely, because people with Alzheimer's and other dementias often struggle to follow conversations that are very quick. So when having, a check-in call with multiple family members or a Zoom call, it's important to have, a person who's the MC who has an order of service, so folks have a time to talk and connect, but the person living with dementia can actually follow what's going on and reap the benefit of this virtual social connection.
That's great. That's great. Now, I believe a lot of us know people who are at the beginning stages of memory loss, are not living in a facility. They're living at home. They're managing their lives, but they've begun to experience some level of impairment. How can we help those people we care about who are in the early stages of memory loss, given that we want to keep the physical distancing in order to keep people physically healthy?
Right. Well, so I think the number one thing is to keep lines of communication open. Many times people aren't ready to face deficits they may have, so it's an ongoing conversation, and what's really important in the conversation is offering help, being respectful and saying, how can I help you, and having a conversation about changes you may be noticing. Again, the Alzheimer's Association can be helpful in terms of how to structure those conversations and have tips and tricks of how to broach those conversations. So we always want to keep the lines of communication open and offer our help, and realize that sometimes we have to offer our help multiple times and check in multiple times to see how the person is doing. Other ways to help is offering to join a telemedicine visit with the doctor. So that we can hear what the doctor is saying and support the person, because often when you have a chronic disease, it's hard to hear everything that the doctor is saying, and that's for diabetes or asthma or anything, and somebody with a mild cognitive impairment could benefit from that help as well. And then I think as family members, it's really important that one gets educated about the disease and what to expect. And getting professional help is of great benefit to families as they're having these conversations, as they start to plan for long-term care. And the Alzheimer's Association can be, in your corner. All our services are free of charge. So we have our helpline that you can call at any time of the day or night. You can speak to our social workers. We have support groups. We have educational programs, multiple ways of supporting the caregiver, but also the person living with Alzheimer's disease or in the early stages. So we have support groups for people in the early stages. We have social engagement. So we are really here to be in your corner to support you at all stages of the disease. And what's great about our free services is you can call us at any time. There's really no question that is too small or issue that we can't talk through with you.
That's good to know. The importance of maintaining agency, that the person who is beginning to have cognitive difficulties doesn't feel patronized, is so important. And why should each of us have to reinvent how to approach our parent, our loved one, while still giving them respect, when you guys have already worked that out in ways that could be helpful, right?
Absolutely. And so that's why, we have multiple workshops that deal with, some of these issues in terms of what are the communication challenges that you're going to expect. We have a new workshop on COVID and caregiving. We realize that there's a lot of issues that have been raised by this pandemic. And so we have education, but you can also speak to one of our social workers, and that gives family members a great deal of peace of mind. And so I encourage people to use it early and often. And so you can reach us at 1-800-272-3900. And so many times I talk to caregivers and they've heard our presentations or they've heard us on the radio and they're like, no, I don't need to call. But then when they do call, they always say, I wish I had done this earlier. I wish I had used these services earlier, because they're a great benefit to families in New York, but all across the United States.
That is an encouragement. Thank you. Thank you so much for your time, for talking with me here today, Dr. Tavares, and for joining us to spread the word about what people in facilities, for instance, may be experiencing, and how people who love someone who is experiencing some memory loss, how we can show our love and benefit them all in one package.
Thank you so much for having me. And again, reach out to us at 1-800-272-3900 or visit our website at alz.org, where there's tons of information and you can be linked to our free workshops and all our services that I talked about. So thank you again.
Mm-hmm. My guest has been the Alzheimer's Association's Dr. Anafidelia Tavares. You'll find a link to the Alzheimer's Association's website right where we've uploaded this podcast at fln.org/insideout. I'm Martha Manikas Foster with Inside Out on Family Life.